and I'm a homeopath. And then I went and did my master's in nutrition. Currently, I'm pursuing basically nutrition and focusing on pediatric nutrition. So today's topic is dietary modification in autism spectrum disorder. And I think most of the participants are pediatricians, and you must be seeing cases like this. And how you can help your patient understand the dietary requirements of the autism spectrum is, I think, is of good importance. So let's just start today's presentation. So first we'll do the introduction of autism spectrum disorder and its prevalence. Uh, so the diagnosis of ASD is mainly reported by behavior patterns like social impairment in the social communication and interaction accompanied by restricted and repetitive behavior. So in India, a study was done in the North and West India states, and they found that 125 children between 2 to 6 years of age group and 80 among 6 to 9 years are showing symptoms of ASD. And in India overall, there is 1 in every 89 kids suffering from ASD. So what is the autistic spectrum disorder? Basically, when we combine diseases like ADD, ADHD, anxiety, depression, sensory integration disorder, OCDs. So this is all together is autistic spectrum disorder. Normally, we see these cases in children wherein symptoms like behavioral system, socially they are not capable enough to react to social stimuli. So this is what we see in the autistic spectrum. And we won't take much time and directly get into the nutrition and how we can help these children and their parents to give a good dietary and nutritious lifestyle, which eventually will help with their symptoms of autism. So normally, the common challenges that we see in this disorder is this: there is a high rate of gastrointestinal dysfunction that we see. Also, there is the food sensitivity. The kids are not comfortable with the taste of some food or color or even the texture of some foods. Then there is food aversion. So most of the kids, they have very narrow selection of what they want to eat, and they are very stuck to what they're eating, and they do not want to try anything new. Another nutritional issue that we see is the food allergies. Now, most of the time, the kids are not, they cannot communicate that something is causing an issue. So parents, they keep on giving this foods to the kids which they are allergic to, and they are not able to express themselves. So we also find these allergies which we get to know very later in life. Apart from that, we have the ritualistic eating behavior that we find in the kids. And also, when researchers have shown that the kids in the autistic spectrum, they have a lower intake of protein, calcium, vitamin B12 and vitamin D compared to an average child having a normal diet. So these are the challenges that we are facing, and as a dietitian and as doctors, we all try to find ways to combat these challenges. So as I said, there is high rate of gastrointestinal dysfunction. So why are these kids having that issue? We have to find out. Now the main problem they are facing is gut inflammation. Why it is happening is there's a lot of stress is there in the kids, from not just stress, the symptoms that are present in an autistic behavior, all the symptoms like social discomfort, physical also, all this accompanied together, it whatever food they are eating, there is incomplete breakdown of the protein. So what happens is the peptides that are formed due to the breakdown, the body feels that this is the intruder, and there's a antibodies, they try to expel these peptides. So because of this, there is a histamine reaction that is caused in the gut, and there's inflammation. Now because of the inflammation, there's dysbiosis, and all we have this imbalance of the microbiota of the gut. Once that happens, all the toxins, they try to trespass the blood-brain barrier, and then we find the behavioral symptoms in these kids. Again, because of the behavioral symptoms, there is stress, and the cycle just continues. And this is through research that we have found. What to do when this problem is there is the main thing, a healthy diet. So in any case, the healthy diet has two components, that is macronutrients and micronutrients. That is the basic of it all, and everyone knows about it. So in macronutrients, we have carbohydrate, proteins, fats, and micronutrients are vitamin and minerals. And we just have to make sure that this healthy diet has all these components present, so that the child can have a nutritious overall well-being also is better. So when we go into macronutrients, the first thing comes up is carbohydrates. So in a basic diet that we advise to this patient, we have to focus on complex carbohydrates like whole grains, fruits and vegetables, and we have to reduce refined carbohydrates like flour products like breads, biscuit, anything that's made of refined flour, pasta, the bakery item like cakes and pastries. Another thing we have to avoid is sugars like juices and refined sugars. The reason behind this is the healthy diet. Even in a normal average individual, this is the basic that we do, and that's how we have to start the diet for these kids. Another part is protein. Now we all know that protein are the building blocks, and they help with the growth and the repair. They also help with neurotransmitters. They also improve immune responses and detoxification. So what we need to do is we have to give healthy protein to these kids. Now in this case, we have to avoid soy protein, mainly because it might cause inflammation in the body. And apart from that, we can advise fatty fish, eggs, lean meats, beans, nuts, seeds, all these healthy proteins. Even because our country, most of the people are more comfortable with vegetarian diet, we can go into legumes and beans. So to give a healthy protein diet. Next comes fat. So now fat is also essential for the brain and development and function. It reduces inflammation. Also, it balances hormones and mood, which is very common in these cases that we see. The first thing we need to do is avoid vegetable oil, canola, sunflower oil, because these are the unsaturated ones. And we have to substitute this with olive oil, coconut oil and ghee. Now coconut oil and ghee are saturated oils, which helps with the brain development and functions and reduces inflammation. Then apart from that, olive oil is rich in omega-9. Apart from that, the most important fats that we need to include in the diet is omega-3 fatty acid, which actually have shown to reduce anxiety in ASD, and that is present in fish oil, flax seeds, chia seeds, and supplements of DHA and EPA. Apart from that, we now come to micronutrients. Now, micronutrients is basically vitamins and minerals. As I said before, these kids mostly we find that there is a deficiency in vitamins and minerals, and that is mainly because the sensitivities and the aversions and the behavior, eating behavior that we find is very rigid. So for that, we have to try and accommodate especially these vitamins and minerals that are very important, like vitamin B6, B12, vitamin A and D, and vitamin C. As I've I've presented over here the sources of these vitamins, which even you can inform the patients, the parents of the kids, that they can include in the diet. Then comes the minerals. The most important one that we have to include is zinc, magnesium, calcium, folic acid, and iron. Now, these minerals are really important for the brain development. And you can find there we do have these minerals and vitamins both in vegetarian options and non-vegetarian options. So we just have to make sure that we provide these vitamins and minerals to the child's diet in some way or the other where they can intake it. Now, this is the basic healthy diet that I've talked about. but some cases we have to go for different types of different type of diets, where we have to make changes according to what the body of the child requires, depending on their symptoms. So we have different dietary options present. The first one and the most researched one is the gluten-free or casein-free diet. Now, as I had explained that the gut inflammation. Now, again, gluten and casein, both they give the undigested peptides that we get from this is causing this disturbance in the brain neurotransmitters and causing the behavioral symptoms. So this is the most researched, and basically because there is a biochemistry behind it, that we can see a difference and we can find out what the cause is. So that's why this is the like a good start when we start a diet for especially autistic and ADHD kids, wherein we have to avoid gluten products like wheat, barley, pasta, and avoid dairy products like milk, which is 80% casein, and dairy products like paneer, curd. So we have to make sure that casein is also absent in the diet. Now we can see what the child is more accustomed to, and accordingly see what the symptom they are facing and change the diet accordingly. It can be both gluten free and casein free, or it can be either gluten free or casein free. So again, every child is different, every family's dietary pattern, the economic status, everything is different. So whenever we are planning a diet like this, we have to take in account all those things and individualize the diet basically, because one might give a good result, another might not. So it's a good start. We can try one food, then remove the other one. So this is a very good start when we are starting a diet for kids in the autism spectrum. Apart from that, once we have this option, we can refine the diets, and the next one is called a Feingold diet. So the Feingold diet is basically we are removing all artificial food colorings, flavorings, sweetener, preservatives, and some foods that has high salicylate. So what we have found in research is that when we eliminate these things, there is reduced hyperactivity. There is the impulsive and compulsive actions also have there's some difference in that. Emotional concerns are helped out, the attention span improves, and the neuromuscular involvement problems like learning disabilities also help out. Again, sleep disturbances also improve. Now this is few researches that have shown the result. Again, we anyways a healthy diet should we have to eliminate these food color and preservative, all that's a very good thing. But in these cases, once we have started a particular diet, we can start with removing these and see if we are finding any difference in their behavior and in their symptoms. The next diet is the Candida or anti-yeast diet. So now we have found that kids have very the sugar cravings that they get, but in these cases already the gut microbiota is almost in imbalance. So what happens is there is a yeast overgrowth, and then because of the sugar cravings, there's also stress and anxiety and the blood sugar imbalances. So the first thing we need to do is remove the sugar, and we have to improve the microbiota in the gut by giving gluten and fermented foods and probiotics to the child. So the research has shown that when we make these changes, there is obviously differences that are seen in the GI tract issues that the child faces. Apart from that, hyperactivity, mood swings, attention span also has shown differences. So again, it is very similar to the first, so not similar but different to the first diet that we have started. Again, we have to see if there is a symptom like this available. If the child is showing a symptom, has sugar cravings, and we are seeing this yeast overgrowth and rashes and infections, then we can go on with the diet like this. The next one is called the special carbohydrate diet. Now this again will help with the GI symptoms, and it helps with improving the gut microbiota. It has shown to reduce autistic symptoms like tantrums, screaming, aggression. Basically, what we are doing is we are focusing on very few carbohydrates and removing the other. So there is no grain, there is no starchy vegetables, there's only fruits and only non-starchy vegetables. Now this is a very specific diet. So when we are thinking of a very specific diet like this, we have to make sure that there is a problem that we are seeing and we have to solve that. Again, this is the refinement of the first diet that we have seen. Some other diets that have been in use and helps in some cases is, one of them is the ketogenic diet, which is mostly used when there is autism symptoms along with the seizures that are present. So as we have known since some time, is that ketogenic diet helps a lot with epileptic cases. Now epilepsy or seizures along with the autism spectrum, the ketogenic diet does show a good amount of difference. Apart from that, we have the food elimination. Now as we have talked, like there's food allergies, sensitivity and tolerances, so we have to eliminate these foods and introduce them back later on when the child is more capable to take in these foods, and accept, there's acceptance towards these changes. Then we have another diet which is called nourishing diet, and it is basically we are removing all the processed foods from the diet and just focusing on whole food. Now most of the diets are very similar, but again, as I said, every child is different, and we have to focus on what the case is and individualize what the requirement is. Then the last option that we have seen is the low oxalate diet. When there is a lot of inflammation or pain, so symptoms related to that, we can go on for low oxalate diet. Apart from dietary options, we can certainly go for supplementations. Uh, as I said, there is chances of nutritional deficiency in the autism spectrum. So at that time, we have to, obviously diet is important, but then we have to go on with some supplementations like vitamin supplementation, minerals, with omega-3 can be given, some antioxidants can be introduced. The main cause behind it, that when we see that the child is not taking the diet properly, they are not accept, there's a low acceptance towards what is produced to them. So at that time we have to make sure that at least their nutritional well-being is there, and we have to introduce some supplementation. And it takes off the burden from the parents also to just force the child with the different foods that I introduced. So I've actually discussed all that is there to how we can help nutritionally, and the next thing is how a dietitian can help. So obviously, when there is a consultation going on, a doctor will help out the family with all the required advices. But how can a dietitian be of help? So the first thing we can help with is the nutritional assessment. So when we do a interview or a consultation with the child, we can determine what is the dietary need of the child. We can see if there are any nutritional deficiencies through what they're eating, what they're accepting, and we can make some recommendations to improve their well-being, to improve their health, depending on what we have found during our assessment. Apart from that, again, food selectivity, so we can help and develop strategies along with the doctor and the parents, so that we can expand the food choices, and we can give practical options, to whatever eating challenge the child is facing, we can advise them how to make those challenges and find solutions to them. Apart from that, again, gastrointestinal issues are most common, and then we can help out with dietary modification and solve problems like constipation, diarrhea, abdominal pain. And eventually, again, special diets and nutritional supplements also can be advised after we do a proper nutritional assessment. So that's all from my side, and I will be taking any questions that you have. But the diets that I have I have told about today, they are basically what the different researches and different dietitians have found have helped. But at the end of the day, every child is different. We take in every case as an individual case. We do the assessment and we see what is the requirement, and depending on that, we make sure that we make a diet that is good for them, and that's how it works out at the end of the day. So we can start with Q&A. Just a second.
Although the topic was small enough, but we will have a lot of questions.
Yes.
So at the moment, there is no question from the group, but in case I receive some, then I'll definitely going
please
to share it with you.
get back to me. I try to make it as simple as possible and understandable.
Yes.
But anyways, if there's any question now or later on,
There is one request or come suggestion from Dr. Swati to summarize the entire presentation. Can we do that?
Yeah, I can do that. So basically, what we have found today is like in the autism spectrum, the first form of advice that a doctor or a dietitian has to give is of a healthy diet, which will include a good amount of macronutrients and micronutrients. And if the child is comfortable with it, we can just introduce the basic diet, wherein the refined foods and the processed food have to be avoided, and we have to focus on whole foods, fruits and vegetables, and healthy fats. Apart from that, depending on what kind of case it is and what are the symptoms the child is facing, we can first of all go start with a gluten-free or a casein-free diet, which is basically wherein you have to remove gluten products like wheat, rye, barley, and remove casein products, basically milk, which is 80% casein, and dairy products, and then introduce gluten-free options. And we also have to find out that any product that we are giving to the child has not come in contact with products of gluten and casein. So that is the first special diet that is normally used, the most researched one, and that has shown to help out with the symptoms. Apart from that, we have the Feingold diet, which is basically elimination of artificial colors, artificial flavors, sweetener, preservative, which has shown reduction in hyperactivity and reduction of many of the autistic spectrum symptoms. The next diet we found out was the anti-yeast diet, wherein there is more lot of yeast overgrowth in the microbiota, and we are assessing it and it with fermented foods and probiotics. The next diet we did talk about was a special carbohydrate diet, which was very specific, wherein we are not taking any refined carbohydrate, no grains, no starchy vegetables, and we are only focusing on fruits and non-starchy vegetables. Basically, it helps with the GI symptoms and improves the microbiota of the gut. Some other diets we have focused on was ketogenic diet, which is given in cases wherein there is seizures present along with other symptoms. There is food elimination in case of allergies, sensitivities, intolerances. Then there is another diet wherein we have to stop all kind of processed food and just focus on unprocessed whole foods. And then there is low oxalate diet, which is basically to reduce inflammation and pain. And the last thing that we found out was if there is in cases wherein the child is not comfortable with the diet that we are providing and not taking enough nutrients, we have to start with supplementations to overcome any deficiencies that we have seen. And that is it. That's the basic summary of what we have talked about today. I think that's just it from my side, but if there's any questions, any queries is there, I can answer them.
Dr. Simran, there's no other question. We'll close the session for the day. If at all I receive any questions, I'll share it with you.
Okay.
Okay, great.
Yeah.
Thank
you so much for your thank you so much for all your time and listening to me patiently.
Thank you.
Yeah.
Thanks a lot.
Okay, thank you. Bye-bye.